Hello? Hello, hello, hello. See? Is this the proper height? Is it working? Good? Okay. Hi, all. Welcome to Matter. Thanks so much for coming in the middle of the day on a Tuesday. How many of you have been to Matter before or know what Matter is? A good chunk. This will make my job easy. So my name is Paige Edmiston. I head up the marketing team here at Matter, and I am so excited about today's event. For those of you who don't know, Matter Corporate Innovation Accelerator and Community Nexus. And really, the goal of doing those things is to accelerate the development of new technologies together with really cool people. So part of that is telling amazing stories, which makes today's event very important. And we are thrilled to produce this together with our lovely PR partners, Public Communications, Inc. They have a passion for storytelling in healthcare. And at Matter, we have a lot of amazing stories in healthcare. So it's been a really wonderful match. And this has been the first big event we've hosted together. So thank you for all coming and checking it out. We are also thrilled to have 4 of the top healthcare and startup reporters in Chicago here with us today. And I don't know, how many of you work in PR and communications, marketing? How many of you are entrepreneurs? How many of you feel like you have a good idea of what gets a story into the news? All right, so some of you. I sometimes feel like the analogy of the black box in AI is what pitching a story is like, and that's probably because I don't know all that much, but I feel like I will know a ton more about what happens inside of that box after this panel. So thank you so much for coming to learn with us. If you have questions about how to get a story picked up, today we're using matter.socialqa.com, which is listed up on the screen here, and you can ask all of your questions, and our lovely moderator will bring those up. So finally, I will stop talking here, but I am thrilled to have Mary Erangey as our moderator today. She is a Senior VP of Communications at Public Communications, Inc. She's just lovely to work with in general. She knows so many things, which is great for me. And you know, what I wanted to leave it off with is she is also a rock cellist and singer in the band Curious Grace and Black Rabbit, which, let's applaud that, for sure. That's the coolest thing I think that could ever be in a resume, so I'm just going to end it there and pass it over to Mary. Thanks so much for coming.
Thank you, Paige. Thank you, guys. Wow. Clearly, there's a lot of interest in the topic of today and storytelling. And we really, PCI is so proud to be a partner and a member of this community because it really is all about storytelling and what storytelling can accomplish in terms of advancing innovation. And that's our role here, is to find the stories and help connect the stories coming out of this community with the storytellers who are our journalists. And why don't you all come out and join us here? I'm very proud and very pleased. I mean, the thank you that I want to extend to all of you is doubly echoed to these 4 because they are the stars of the show. They are the people who can answer the questions that you have and can give you some real insights on this process. So joining us today, we have Stephanie Goldberg from Crain Chicago Business and Elton Zenon from Built in Chicago, and Lisa Schenker from Chicago Tribune, and Jessica Cohen from Modern Healthcare. So, for All Stars, we're going to have a little bit of a discussion for 45 minutes or so, where you will have a chance, as Paige said, use that social QA, pass along your questions. I'll be watching, and we'll be having a conversation here. We'll give a chance for each of you to share some insights and to just, you know, we had a conversation ahead of time, and I learned some interesting things even during that short conversation. So we're going to get a chance to bring those kinds of things forward to you, and then I will ask some of the questions that you all bring through the social QA platform. And then, in the hope that you all can stick around as long as possible, hopefully some of you can stay. We promise to get you out by 1:30, but if you can stay till then, Some of the fun begins right around 1 o'clock-ish, 1:10, where we had a number of brave volunteers who said they really wanted the opportunity to pitch our media panelists. And the whole point of this is not for them to say, yes, I'm going to do your story. No, I won't do your story. The point of this is the very point of matter as a community. It's a collaborative knowledge sharing that we're after. So this is the chance for the people who are pitching to learn, but also for all of you. When you hear their responses, it'll give you insights into what you need to be thinking about when you have a story that you want to bring forward. So hopefully you will stick around and have some fun with us on that. So how about if we all just get started? Let's see. If you could shift down one. How is everybody? You excited? Okay, great. I just wanted to start with kind of a softball question to just set the stage. Where do you find your stories? Where do you look for story ideas? And we'll just start here with you.
Great. So I guess where I find stories, it kind of depends on the type of story. There's probably news stories and the longer form features. So for the news stories, it's more about checking to see what new government regulations come out, what new lawsuits are happening, getting tips from different healthcare leaders that I speak with, just trying to stay up to date on the news. And for the longer form, more feature stories, it is probably for modern healthcare, our main readership is hospital executives. So it's staying up to date on what types of challenges they're facing and how they're addressing those challenges.
Are there particular places or sources that you follow? Like, are you using Twitter as a story mining tool?
I would say Twitter, definitely. Twitter is definitely one. Just checking email, getting tips there. I would say one of the cool digital tools that's come out recently is now there's more websites that will help you just kind of track, for lawsuits, it'll let you track different particular companies that you're interested in. If you're covering politics, it'll let you track just every time the Department of Health and Human Services comes out with something. And then, of course, just also checking out the news from different healthcare publications and technology publications, seeing what my peers over here are also looking at.
Exactly. You're all a collaborative community too. Yeah. So Lisa, how about you? Where are you finding most of your stories?
I would say similar to what she said, that it's a lot of it's just what's happening in the news, and I'll cover that as kind of my daily news stories. And to find out what's happening in the news, there are certain websites I'm constantly monitoring, and I'm reading a lot of other news providers to find that out. And then people do pitch me things, and that is where I get some of my ideas. Although it may not be exactly what someone has pitched me, I might take what that person has pitched to me and kind of use that as a jumping off point. A lot of it is just watching what trends are happening in the business, just trying to stay on top of what's happening in healthcare. We're very big into trend stories, writing about kind of what is a big movement going on now, what can patients and consumers expect to see in healthcare.
And Alton, how about some of yours where you're featuring companies in specific? Built in Chicago, hopefully we have readers of Built in Chicago out here, and there's a lot that you do in featuring very specific companies. How are those companies coming to your attention?
Sure. So we have a couple of different methods.
Okay.
Can you hear me?
Right.
Should move this up a little bit. Is this better? Okay, cool. Yeah, so for feature stories, we have a few different methods. One of which is Crunchbase, which is like more or less a database of companies that you can filter based off of industry, based off of their founding dates, the amount of money they've raised, things of that nature. So if a company raises a lot of money, then much like my peers here, we'll write a story about that funding story. But even if it's like some seed funding of like $125,000, we'll investigate a little bit further and see if they're working on any cool projects or if they've got a cool founding story or something of that nature, then we'll kind of pursue that as a story. Another one is Form Ds, which is kind of along the same lines as Crunchbase in terms of funding. that basically chronicles all the SEC filings that companies make whenever they get any type of funding. So we'll chase down leads based off of that. And then also like press releases, pitches that we get, we'll use those to investigate companies more and kind of give our readers a peek behind the curtain at what goes on there.
So Stephanie, before we get to you, can we talk about money for a minute? So in the realm of startups and the partners here, you know, there are often stories that are being pitched that have a financial angle to it. Funds raised, you know, donations made, or you know, launch of something. Each of you represent a very different media publication perspective on what rises to the level of newsworthiness in terms of a dollar figure being attached to that. So I'd love it if we could just kind of run down the line and say, what does it take? What kind of dollar figures it take to actually get the attention of your publication?
I would say to start off, for me at Modern Healthcare, we don't normally typically cover funding rounds actually. So I would say we're more interested in if a pitch was coming in more about what types of outcomes customers have seen with the product rather than you know, a specific funding amount isn't normally something I would cover on its own.
I normally also don't cover like a startup getting a certain amount of funding. We do have a tech reporter who covers some of that, although I don't know that we have a numerical threshold, but it definitely, I mean, for us, it has to be pretty jaw-dropping, not just like a few $1 million. And it's also not just the amount for us, it also has to do with who's involved, are there any big names involved, anyone who's well known in the Chicago area. So it's a combination of factors.
For us, we don't have a hard number, but it's somewhere in like the 4 to 5 minimum, I would say. Maybe it might depend on what the specific story is, what the company is. We look at factors about if they're a company that's kind of playing into a trend in the market. There are a lot of different aspects that we kind of look at whenever we get a funding story pitched to us. But for a funding story specifically, it has to be a relatively significant amount of number for us to include that in the headline, for instance, versus us like factoring in the funding that they raised into giving like painting a broader picture of that company.
Stephanie, how about you?
Sure. So we do cover those types of stories at Crain's quite often. But like the other panelists said, it's less about the dollar figure for us and more about like the story as a whole. So some of the same types of things that were mentioned previously.
Good. So the money has to connect to something else, is what I'm hearing there. Is that true for all of you? Okay. And Stephanie, so for you, when you are identifying stories to pursue, so do you have specific places that you look, and you know, shifting to that plus, what makes you actually decide to go ahead and pursue something that's been pitched to you?
Sure. So the places that I look have pretty much all been mentioned. I think one thing that I did want to add to that before I move on to the second part of the question, though, is just building relationships with sources is such an important part of my job. Obviously, I work with a lot of the folks in this room, but even beyond like a media relations relationship, it's just good for me to have touch bases with some of the subject matter experts that you guys work with, because occasionally they'll mention something that seems like old news to you that wouldn't be to our readers, or that I'm extremely interested in. So that's one of the things I wanted to mention as well. And then in terms of what leads me to cover something, the easiest way to answer that question would just be to say, does it impact our readers? The answer to that question is yes. I'm probably going to write it.
Yeah, that's a good guideline. You know, and in terms of, we had an interesting conversation beforehand about sources and keeping information on file. And Stephanie actually has a Rolodex.
I have a Rolodex, like old school Rolodex, and I get made fun of for it often.
But it is a source file. Everybody has to have a source file. And Lisa, you have a method of hanging on to information that people pitch you and retrieving it.
Yeah, I hang on to pitches that are sent to me via email. I may send a note back to the person who pitches saying like, this isn't something I would write about right now, but I'll hang on to it, and I do. And then when I am working on a story that might relate to that, then I will go back and find that. I just did that today where I needed to connect with an organization, and I went back to something the organization had pitched me on 2 weeks ago that I did not write about, but called them up and said, okay, I found your number and I'm not writing about this, but I'm writing about this other thing. You know, can you connect me now with the organization? And they did. So I do hang on to them.
So can we talk a little bit about when a story is pitched to you and it doesn't rise to the level of interest that you would cover it? The topic of persistent pitching versus what does it take to actually have a pitch resurface to be relevant to you? Perhaps, Stephanie, do you want to start that one? Like, you know, if somebody's
Sure.
continuing to pitch you, what makes something turn the corner for you to be worth pursuing?
So I'll start by saying I always try to respond to people, even if it's something that I can't cover. But emails do slip through the cracks, and so this is just my blanket apology to everyone that I have ever accidentally ignored. What I will say is that sometimes the persistence is appreciated because that does happen. But 9 times out of 10, if you don't hear back, it's because it wasn't a good fit. But like Lisa said earlier, we hang on to these things, and sometimes a trend story will come up later down the line, and something that we will remember seeing, because we have pretty good memories. Like I usually will recall these things, and I'll go back and I'll look. And then I might reach out, and it won't be what you pitched me on, but maybe I could use one of your subject matter experts for a piece I'm working on. So that would certainly be an example of that.
Alton, have you had a similar situation where something was pitched and then you kind of came back to it later on?
Not necessarily. A lot of times when I get a pitch, I try and analyze it from every angle, digest all the information, figure out whether or not it's relevant to our readers, and if it's not, then I'll follow up and say this isn't necessarily something we would cover that would really fit for our audience, or if it is, then I'll pretty much like write it then and there, or as quickly as I can if it's really timely. Follow-ups are nice; they're appreciated because sometimes stuff does slip through the cracks, but not necessarily like aggressive ones. I would appreciate it if you didn't like flood my voicemail 5 times a month. But with that being said, yeah, feel free to follow up, just kind of within reason.
Is there any advice that you would give to the best ways to follow up?
A quick email would suffice usually. That works for me.
A 9-page email?
Probably not. If you could hold back a little bit, that would be good. But yeah, just something quick, simple, like, hey, just wanted to put this in front of you again. And I try my best to like respond to every pitch and everything I get like immediately, but sometimes that doesn't happen.
Any other advice, Jessica or Kim, about how people can best follow up with you?
I would say in terms of follow-ups, sometimes it helps to ask for advice. If, like Stephanie mentioned, a lot of times if a reporter doesn't respond to a pitch, it's because it's not a good fit, and it never hurts to just, follow up and be like, hey, wanted to put this in front of you again. If it's not a good fit, that's fine. Just let me know why. And sometimes I have responded to those and been like, I really focus on hospitals and health insurers. This direct-to-consumer product isn't necessarily what I tend to cover most of the time, but I'll keep it in mind if it becomes relevant. So I'd say it never hurts to just ask for feedback, ask for advice there.
So the audience has upvoted. There's a particular question I think that segues very nicely from this. If each of you could talk about the specific focus areas that you have for your coverage and any hot topics of interest, and in particular, like topics that you cover on a recurring basis, say quarterly, that you come back to. And if maybe we'll start here with you, Jessica.
Definitely. I don't want to go off onto a different tangent, but I think the thing that might be most relevant right here is one of the things that I do at Modern Healthcare is we have an innovation section that specifically talks about different ways that it's basically case studies of how different hospitals are using a particular new innovative types of technology and the specific outcomes that they've seen from that. So for that, that's where I tend to work with startups the most, and I purposely try not to focus on any specific one topic and try to keep it pretty diverse. So I would say just any time that someone can provide me with concrete information about cost savings a hospital has seen, safety outcomes a hospital has seen, those are the things I look for.
And so that was kind of a theme, I think, we all talked about data, correct? All of you really are looking for opportunities to validate your stories with data. Just so that you all know that that's one of those things you want to tuck in your back pocket, look for that, have that ready for them. Kim, how about you?
I would say that I am interested. I write a lot about health insurance. I write a lot about doctors and hospitals and what they're doing. I mean, my audience is a little different in that this is a lay general audience. So I'm looking for things that are very consumer facing, that are very patient centered, not things that speak necessarily to people running hospitals or even the profession of medicine. So that's who I'm aiming for. Every story I write has to kind of answer the question of, what does this mean for the consumer? What does this mean for the patient? And so I'm always looking for innovative things going on in those areas, but there has to be a lot of impact. It has to be already impacting people, not something that like might impact people once it grows bigger in 4 years. And as for perennial topics, I don't know how helpful this is to this room, but I mean, I'm constantly writing about changes at the federal level to healthcare policies and rules surrounding the Affordable Care Act, all sorts of things, all sorts of changing rules and regulations. And I'm always revisiting the topic of health insurance and the pricing and where the market is with health insurance.
There's a theme here, numbers.
Yeah.
Elton, how about you? What topics are you really looking to cover, really pique your interest, come back to time and again?
Sure. Our audience is pretty big on big data. They like, and across really any industry vertical, but particularly in healthcare, because now with the use of big data, there's so much opportunity to kind of change outcomes for patients and do a lot of really like meaningful, impactful work in the healthcare sphere, which is like affecting the lives of people literally every day. And I love what you said about the audience being like wanting to see impactful change happening. That's a big part of what we found is key about our built-in audience. They are very like purpose-driven, impact-driven people. So with that, it's easy for them to resonate with a lot of the topics in healthcare. You all almost have like a cheat code as far as like getting to our readership in terms of that. But big data is definitely something big that a lot of our audience tries to pays a lot of attention to.
And can I follow up on that? I've seen a good deal of internal culture articles as well that you've done. Is that an area of ongoing interest for you?
Absolutely.
Okay.
Yeah.
So another way for you to think about your stories within your companies, it's not just what you do externally, it can also be what you do internally, correct?
100%.
Great. Stephanie?
Similar for us to a couple of the other things that have been mentioned, one thing I will say about Crain's that's a little unique is because our readers are not necessarily just patients, and because our readers are also not specific necessarily to the healthcare market, I have a little bit more wiggle room with what I can write sometimes. So occasionally it's a trend that's impacting patients, occasionally it's a trend that's impacting hospital administrators or insurers, or folks like in the technology space, vendor partners. So it really honestly depends on the story. Does it speak to a larger trend? Does it impact the Chicago area? Those are the questions that I routinely try to answer.
Yeah, Chicago market. Remember that too. You know, if there's a local impact, that's one of the things that you all are going to be looking for. And there is a huge amount of interest in the audience here in this question, which will be interesting for all of you. if the people in this room wanted to get an opportunity to meet you, make a connection, just to start networking a relationship with you, how would they go about that?
Is that a trick question?
It may be.
I've got some business cards in my pocket.
So would you recommend they send you an email out of the blue? Would you recommend that they come to an event like this and try to introduce themselves after? How, let's do it this way. Can you think of times when you have made a connection with somebody who has gone on to become kind of a source for you, and it was just a connection, it wasn't a story pitch? And how did that come about?
Call, email, come find me in person. I'm going to leave it up to you.
That's true. I would say I definitely email. Always, I've definitely made connections via email if you're Chicago-based. I'll also do coffee meetings with people if they just seem like they're working on something interesting that we want to discuss a little bit more, even outside of a formal interview.
I would say email is, I mean, if you're at an event and you see me, say hello, but otherwise email is probably my preferred method. And also in the email, make sure your subject line reflects that you are in Chicago, because I get a lot of pitches from other areas of the country and we don't really cover things that don't have a Chicago connection. So I tend, if I see an email that has no connection to Chicago, I pass it up pretty quickly. So I don't want something to slip through the cracks that way, just because, you know, I didn't have time to read through the whole email.
Email for me as well. LinkedIn works as well. I'm trying to push myself to go to more tech industry events, so if you see me at one of those, come say hi. I'd be happy to chat.
And in the email, if they send you an email, do you want that email to make it plain right up front that they really just want an introduction? This is just an opportunity to chat. They're not pitching you. Should that be spelled out?
Yeah, for me, I would say that is something to just be like, want to brief you on XYZ topic. I might not always have the chance to talk about it at that specific moment, but I would say there's definitely no harm in just making a connection, even if you don't have a formal pitch. And I do want to clarify one thing, which is I think I'm the only panelist here who's at a national publication and not a Chicago-specific one, so definitely I'm looking more at national trends and not a Chicago-specific angle, although I am based here for in-person meetings.
And I do want to be careful here because we don't want them to be swimming in emails. So be thoughtful about the way that you reach out for those introductory conversations. So this actually relates to this in terms of locationally based companies. Lisa, in specific for you, do you prioritize companies that are based in Chicago?
Yes. Definitely. If it's a company based in Chicago, then that gets my attention. If it's not based in Chicago and doesn't have a strong Chicago connection, I won't write about it.
Is there a way what would be the elements? Let's say the company isn't based in Chicago, but are there elements to create a connection to Chicago that would make it relevant to you?
If the company is working with big organizations or big names in Chicago or has been widely adopted in Chicago, then I might write about it from that angle, but the story probably would not focus on the company. It would probably be more like, what are the players in Chicago doing that might be related to the company?
Thank you for stating that. This goes back to a little bit of the conversation we had ahead of time. I want to call out the distinction between stories that focus just on your company, your initiative, your event, that are so singular, versus stories that you may have an opportunity to be quoted in, offer expert comment in, or a specific example where it hangs into a larger issue. And so that you and I had been talking about that in terms of that being one of the things that often gets your attention. Lisa, can you elaborate on that a little bit?
Sure. I mean, I will rarely, if ever, write about just like one startup and what they're doing, but I will use that maybe as a voice in a story. I mean, this happens all the time where I get pitched on something that one company or one organization is doing, and I'm much more interested in the bigger trend. And so if there's a bigger trend going on that seems really interesting or unique, or people haven't heard of it and it's affecting people, then I might write about that, but just use that company as one voice in the story.
So then let's take that to the next level. Another question that's quite popular here. If the topic that you're working on, that you're pitching, isn't yet a trending topic, how can the folks in this room pitch that to you to elevate your interest in it, even though it's not yet there?
I mean, I would say, continue to keep in contact with me if you think it's going to be, because I always want to write about trends when they're at the beginning, as opposed to, being the 50th person to write about a trend. I mean, sometimes things just take some time to develop. Maybe it takes a year for it to kind of grow legs, but that's okay.
Anyone have anything they would want to add to that, Stephanie? Or
It's very case by case. But for something like that, I guess the question that I would ask you to ask yourself or your company would be, well, why are we working on this? And I'm sure there's an answer to that. And maybe that speaks to the way that a particular piece of legislation has been introduced, or something else. So even if it's not a larger trend by like the traditional standards, like maybe maybe it's not the rule of three, but maybe there's something else out there, or a common problem that it solves.
Great. And I think, so there's a question here too about if you're not a startup, but you're an established organization, how do you get back into the news as relevant? So you're not out there at the leading edge breaking ground anymore, but you're already established. What are the things that you look for to persuade you to cover those organizations? How about you, Jessica?
Okay. For me, I would say that it does definitely come back to the hospital or health system or health insurance angle or health insurer angle. So most of the time when I'm writing articles, am focusing on, a specific hospital that might be using a product, whether that's a product from a startup or from a more established company. It's more about figuring out what challenges that hospital leaders are looking at right now and the different ways that they're working to solve them, regardless of where that's coming from.
How about, Kim, how about you? Because you do cover a number of established organizations.
It's Lisa.
Oh my God,
It's okay. It's all right.
I've done that.
It's okay.
See, we all make mistakes. Sorry about that.
No,
My
it's okay.
apologies.
I mean, I'm in constant contact with hospitals and hospital systems, and insurance companies and pharmaceutical companies. I mean, at the Tribune, we're very interested in personnel changes and location changes. If you're hiring a couple hundred people, or if you're changing locations, if you're introducing a service, if you're cutting service. But I'm also just in constant contact with these organizations for, I don't know, I hate to keep talking about trend stories, but for trend stories, for things happening, where I do a lot of stories where I call, all the major hospital systems in the area and say, hey, do you have this? Are you doing this? And same with insurance companies and pharmaceutical companies.
And Alton, do you cover established organizations?
Yeah, absolutely.
Okay. Are there particular things that you look for those?
Mm-hmm. So I kind of look at it through the lens of like, how will this affect our readers, either directly or indirectly? Kind of to your point, are they hiring at all? Are they expanding their office space into a new, bigger building? Are they rolling out any really cool like diversity initiatives or any type of like cultural things internally that they want to share with the rest of the tech community? Even if it doesn't have to be like a long-winded 1,000-word piece. It could just be like a quick little 250, 300-word piece. Like, this company's doing something cool in relation to like their diversity initiatives. So we'll look at it through the lens of how will this directly affect our readers in one way, shape, or form.
Stephanie, how about you? Anything particular?
I everything that I would say, I think, has pretty much been touched on. The other thing that I would add is like deals. I think, I don't want to speak for all of us, but I think we all pretty much have been covering like M&A and consolidation. And so even if it's like a small piece that you're buying or divesting, like I think that would probably be of interest to all of us.
And so speaking of all of you, one of the other questions here is, is it okay for them to pitch a number of journalists at the same time? Let's say they're bringing a story, specifically this could happen quite often. Stephanie, you and Lisa maybe get the same pitch. Is that okay, or is that considered a bad practice?
Of course it's okay. We love exclusives. Like if you want to pick one of us, I think we'd be very happy to take it exclusively, but of course it's okay to pitch multiple people. One thing I would note, and this is something that Jessica and I were actually talking about earlier, not so much pitching across the market, but we all, in the Crain's newsroom, I'll just speak for, we sit pretty close. Like we have pretty good communication, and occasionally like we'll all get the same pitch, even though I'm the only healthcare reporter. So that gets a little messy. Like if I'm gonna take the time to respond, like try not to send the same thing to like my real estate colleague and also my, because then we just have to forward it to each other. So do be mindful, like when you're looking at the masthead, like who covers what. Do try to be, or if you want to include multiple people, maybe put us on the same chain. That would be the piece of advice that nobody asked for.
Good advice. Good advice. Any other advice on that in terms of, do you get that same thing where you're being pitched multiple people inside your newsroom at the same time?
Yeah, I would definitely say at Modern Healthcare it happens quite a bit since there's a fair amount of overlap. So I would highlight kind of the end of what Stephanie said. If you're working on a technology that I'm the technology reporter at Modern, so if you're working on a technology that also helps with ensuring high quality clinical outcomes, definitely feel free to pitch it to me and the quality reporter, but maybe send it to us both at the same time so we're sure that we both know that both of our eyes are on it. We can discuss, figure out who wants to cover without it kind of getting hairy if we both respond at the same time separately.
Great. So let's talk about emails have come up a lot. Obviously, it's one of those methods of communication that's kind of a love-hate. Everybody relies on them, and yet we get bombarded. So the subject lines. People want to know what's the ideal length of the subject line and what kinds of things catch your eye, and then the pitch as well. Like how long would you ideally like to see a pitch be, if you can put that kind of guideline on it?
The shorter the better.
And when you say short, so are we talking for the pitch length, a paragraph?
That's fine. I think one thing that I would note, and I don't know if this is a personal preference, so I'll ask you guys to correct me if this is not across the board, but I do find that sometimes pitches try to be like a little cute and creative, and like frankly, we don't have time to read those. Like, just get to it. We can be cute on the phone later when we're talking, but it's just email maybe isn't the time.
Yeah, I would definitely mirror that for sure. The shorter the better. And I'm speaking for myself. I'm not speaking on behalf of Built-In as far as this practice, but I pay little attention to the subject line. Like as short and sweet as that can be, the subject line, I'm opening every email that I get and like reading it, so the subject line isn't nearly as important as like what's actually in the body. And presenting like the reasons why this is a story that's worth telling as early and quick in the email as you possibly can that's what I appreciate the most.
Is that true for you as well, Lisa and Jessica, that you open every email that you get? So does the subject line have that same kind of like it's not going to be a definer?
I'd say the subject line is very important for me. On an ideal day, I would open every email, but on a day where I'm very busy, I don't open every email because I don't have time. I get a lot of pitches and I don't have time to look through each email to see what's going on if I'm on deadline with a couple different stories and have things going on. So it is, I just can't emphasize this enough, at least for me and my purposes. If you can put that there's something local in the subject line, that will make me open the email. Whereas if I don't see anything local in the subject line, I might pass over it on a busy day and then I try to get to it the next day, but that's how stuff falls through the cracks for me.
I would say I'm kind of more on the side of Alton. I don't pay a ton of attention to the subject line, but what would be helpful in the subject line, if possible, is what type of request for information you're providing. So in the example that you gave earlier, if this is just, want to chat, want to brief me on what your startup does, put that in the subject line. If you have specific news about funding or something that's coming out, put that in the subject line, just so I know whether I'm opening a news pitch, a source pitch, just in general information. The more specific, the better.
This is all really good advice. I hope you all are writing this down. One of the other questions, which actually goes back to something that came up a little bit earlier, Elton, you mentioned diversity initiatives. What does your publication do, if anything, to cover and give exposure to women or other minority audiences and groups? And Elton, if you could kick that off, because you brought this up initially.
That's kind of something we really pride ourselves on being able to do at Built-In, is like given a lot of focus and a lot of like articles dedicated to that specifically. We'll reach out to companies of all sizes and try and get quotes from women in these organizations, people of diverse backgrounds in these organizations, and just chronicle like what their experiences are and what kind of initiatives exist at these companies to make them feel more comfortable. It's something I enjoy writing about a lot personally.
I would love to jump in because
Go.
Crain's has some unique packages that they put together where they feature women in business locally. We have one coming out, our most powerful Latinos list. So there is a push to make sure that different groups of people are highlighted more. And so beyond just what I think about every day when I'm trying to make sure that I have a good mix of sources and companies, there are like separate packages that we'll put together to make sure that we're being fair and recognizing all of Chicago.
And Modern Healthcare, you do some of the same, right?
Yeah, we do some of the same where we have our women's list, a minority leaders list. Since I specifically cover healthcare, I'm not, involved with those really, but it is something that as a publication, we're keeping top of mind.
And here's an interesting question that the audience has surfaced to the top. Have any of your publications ever squashed a story because it may offend an advertiser or hurt business in some way?
Absolutely not. I think you all know that.
That was unequivocal. And does anyone have a different answer?
Mine's
Same answer.
kind of along the same lines. Rather than like avoiding a topic because it would offend any like one company in particular, we only skew positive. We don't like publish any negative news of any kind. So if there's like really any bad news that comes out, then we don't really touch it.
Got it. So that was a pretty clear setup. And I have one last question from the audience, and then we're going to do a couple of quick little things, and we're going to shift gears into the Shark Tank. And you all have been very attentive, and thank you for that. I haven't seen any stirring. So what, if we can kind of, lessons that they would take away, the things that make a good story, what really grabs your attention? If you could kind of sum up some of the things you've been saying and really distill it into quick advice.
Definitely. Do you want to preface this by saying I can only speak for myself as the technology reporter? I'm sure other reporters covering different beats at Modern Healthcare have different things that they're paying most attention to. But for me, I'd go back to the idea of the technologies I write about. I want to make sure that I can kind of see some concrete data with the outcomes, whether it's cost, whether it's patient safety, whether it's efficiency. I'd like, in an ideal world, I love to talk to hospital customers on the record who can speak to their experiences working with the startup. Just the more that I can see those outcomes, the better.
Thank you.
I am generally looking for things that are new, that are beginning to trend, that are unique, that have kind of a wow factor. Like if I read something and go, what, really? Like that's really interesting, then I know that's going to be a good story. Things that have impact on consumers and patients and that are already having impact. And also, I don't think I mentioned this before, but I mean, I'm very interested in the human stories. I mean, like I said, I don't typically write about like standalone startups, but if the founder of the startup lives in Chicago or the Chicago area and has some sort of like super compelling personal story that ties into what they're doing, I mean, that's something that would push it a little higher for me.
Good advice.
This is gonna seem lazy, but ditto.
It's honest.
Literally all of those things, yeah. If it's marking on a trend, I couldn't say that any better.
I was actually trying so hard to think of something to add. Those were really good answers. I agree.
Okay, so final question. This is your last chance to this is your chance to speak to them and say, these are the things I really want you to know about what you should do or absolutely not do in pitching me a story. And then we'll shift over to the Shark Tank pitches.
I would say, as the final piece of advice, if you're unsure if something is a good fit for the magazine, definitely feel free to just shoot me an email and ask, and I can give feedback on whether it's a good fit or whether it might be a better fit for a different reporter on the team. Because I would say the main frustration I have when I get a lot of pitches is when, I write about technology for healthcare organizations and I just get random pitches about technology used in video games or in athletics or things that just aren't a fit at all.
Yeah, I would say it never hurts to ask the reporter how they prefer to be contacted. For me, it's email, and I don't mind persistence over email. Like I said, because occasionally things do fall through the cracks for me. So if you think something is a really good fit, if it's kind of a long shot, then if it's a little bit of a long shot, then probably don't send me 3 emails about it. But if you think it's local and it's impacting people and there's a really compelling story, I don't mind a few emails over the course of a couple weeks about it.
One thing I think is important is being reachable after you make a pitch or after you contact us to make sure that you are easy for us to get back in contact with you. I've definitely had a couple of stories just kind of get dropped altogether because I reached out for an interview or wanted to do some type of follow-up, but no one responded to my emails or calls, or maybe they did, but it was a little bit too late because it was more of a timely story. So just make yourself as available as possible for a little bit after a pitch.
I'm going to piggyback on that before I switch gears, but I won't drop a story if I can't get in touch with you. I'm just going to have to write it without you. And so it's easier if you can be available. I think a lot of times, maybe there's a fear of saying too much, but I don't know. I never feel like I'm out to get anyone. News is news, and I pride myself on being objective. So if you can be available, great. We can work together on something. Something that I was going to note when you originally asked the question, it made me think of the biggest piece of advice that I have is maybe just don't be sure you know the angle. So if you're pitching a story, or if I'm writing a story and I contact you, even I might think I know the angle, but then as I'm doing my reporting and talking to my editor, those things can change. And sometimes not everyone likes the direction things go, and that's a bummer, but it does happen. So I would say, please try and be open-minded. Maybe that's it.
Good advice. Thank you for everything that you've shared. Very, very, very valuable. And we won't have time to go into the list of words to avoid using, which we had. That was an interesting conversation. So we're going to shift gears to the Shark Tank. We will keep the social QA platform open. We'll see if we have some time at the very end to just come back to some of the questions you may have once you've observed this pitching process. And Alyssa is going to, a former journalist who is on the staff at PCI, is going to take us through the pitch tank.
Great, thanks, Mary, and thank you all for the great discussion here. So today we are, yes, thank you. So today we are going to give a couple brave members and partners who have volunteered to step up to the plate here and pitch their story to our panel of journalists. So excited for that opportunity. Thank you to all of you who expressed interest in this and wanted to step up here today, brave enough to volunteer to do so. We think that we've picked a good mix that is representative of the Matter community itself, partners and members and different stories. So just want to give a quick rundown of how this is going to work. Again, it is a fun, lighthearted learning opportunity for everyone here in the room, as much for the people getting up here and pitching as it is for all of you in the audience as well. So each person who steps up here is going to have 90 seconds to make their pitch. We are going to be keeping an eye on the clock, so we will hold them accountable to 90 seconds. Want to make sure we get through everyone here that has volunteered to participate today. And then we will receive direct feedback and have time for one follow-up question from the people making their pitch. Okay, so without further ado, we have Monica from Prepared Health first.
You neglected to say how many people would be here when we volunteered. Okay. 3 years ago, Northwestern Medicine was paying an average of $300,000 a year in CMS penalties. One challenge they had was preventing its bundled payment patients from returning to the hospital. Northwestern wanted to help its case managers improve communication with post-acute providers and steer patients to the best and most effective care. They partnered with Prepared Health, a Chicago-based HIPAA-compliant digital platform that connects hospitals to the multiple providers in a patient's care post-discharge. And this could include post-acute care facilities, home care, and community-based providers. The platform includes Dina, an AI technology that acts as a virtual care coordinator suggesting evidence-based interventions. After 18 months on the platform, Northwestern reported that their readmissions rates had dropped 29%, length of stay in a skilled nursing facility dropped by 4.6 days. The number of patients who went to a skilled nursing facility dropped by 25%. And overall results added up to $700,000 in bundled payment reimbursements, which would represent a $1 million net swing from the prior year. Northwestern's Director of Care Coordination said, "We saw that when patients are in more communication with all the members of their healthcare team, they are much more comfortable going to a lower level of care when that's the best fit." Prepared Health is connected to 750 hospitals, skilled nursing, and home health agencies, predominantly in Chicago and the Philadelphia area, and growing across the United States. We'd welcome the opportunity to share additional demonstrated outcomes, including decreased avoidable readmissions rates, reduced unnecessary ER visits, and improved caregiver productivity.
Off the top of my head, I really like that you had a concrete case study with Northwestern. Really like that you had data available and didn't overwhelm the pitch with all the data, but said there was more to share if needed. Follow-up questions I would have if this was sent to me via email is whether you'd be able to connect me with Northwestern, just kind of like what sources you'd be able to provide there. But off the top of my head, I thought that was a really good pitch, actually.
Okay, thank you, but that's good feedback, and I don't always include who would be available.
Mm-hmm.
Okay.
I thought it was a really good pitch too. I thought, you ticked a lot of boxes for me, like you're working with a major Chicago area organization, you're already up and running, it's helping patients, and maybe I missed this, it's possible I just didn't hear it. So is it an app or is it like a platform that just doctors and hospitals are working with? Is it consumer facing?
It's an app. It's not now consumer facing, but it would be a tool that all parts of the healthcare system would use to stay connected, and it would be as opposed to like with discharge, as opposed to sending a fax or calling or emailing, and it would be a way for everybody to be connected, sort of on a sort of like an email chain, but connected on a chat or a chain where you have visibility into every step of the process for the patient. So, for example, if they're being discharged, have they been admitted to their next point of care? If they're going home and equipment was ordered, did that equipment arrive? Does the family or home caregiver have any questions? Is there a wound and you can send a picture? So that kind of thing. So it's just that continual communication.
But right now, it's not something consumers access.
The patient is not, right, it's not
will be.
patient facing.
Okay.
In the future, would be
Okay,
a next step.
I thought it was a really great pitch. I'm looking at it through the lens of like whether or not, based on our editorial policy and our readership, if we would be able to write a story about it. It's one that we wouldn't be able to do like a full-length feature story on. And since the product it was kind of sort of, it had like a soft launch and is being used already, and correct me if I'm wrong.
No, it's launched.
Okay.
Yeah.
Since it's not like super timely, like this is something that is upcoming, we wouldn't be able to write about it like immediately. But when that consumer-facing portion of it does happen, then that would be something that we could very likely feature in one of our stories. And like it would be a smaller portion, but it would definitely fall under the category of something that we could write about.
For us, even without the consumer, I mean, as you know, even without the consumer-facing piece, it's of note given our readership. One thing that I will say, I'm not sure if because I'm familiar with the company, I didn't miss this, but after Lisa's question, I wonder, it would probably be beneficial to put some clearer language, like a one line in there about exactly how it works. Not necessarily like the outcomes it achieves, but like here's how the outcomes are achieved. And again, I think I didn't miss it because I had the background, but I think in the future that might be a good thing to include up high. That said, I thought that was a great pitch. It had everything, all the elements that we had talked about previously.
Thank you. Good feedback.
Great. So next on the partner side of things, as I mentioned, there's a good variety here for our pitches here today. So we have Francis from Rush University.
Thank you very much. And I teach at Rush University. Never done a 90-second pitch, and also I've never done a pitch like this that didn't have a final exam or at least a quiz. But I will proceed. We really are living in remarkable times now in terms of patient care, and Chicago is an epicenter of so much in healthcare in America right now. There's really a tsunami of digital innovation going on now. Wearable devices for patients, chatbots, AI, patient portals. Really, there's so much going on that you can really do some incredible things to improve the patient experience. But what do patients think? You know, there's all this effort about improving the patient experience. Mostly, we don't know what the patient thinks about these innovations. We're at this sort of giddy stage of excitement about the potential of these digital innovations to provide information to patients, answer their questions, guide them through things. But now we're in the phase of very rapidly deploying these things and enrolling patients. So at Rush University, where I teach in the Health Systems Management program, we're doing a national conference that will showcase the case studies from medical centers around the country that have developed cool new tools for patients that work well from a technical point of view and improve the patient experience from the patient's point of view. Speakers are coming from all over the country. Some are local, some are, we're trying to get some Matter involvement from all over the country to talk about very concrete case studies. If you're interested in data, this is what this is about. You don't get on this stage unless you've proven something that it improves it as the patients define it, not how the IT department has defined it. It might sound odd, that the patient point of view isn't really included in the development of these devices more often. And this conference is actually going to try and remedy that. You know, there's a kind of divide between the world of IT and the people and patient experience, because I think they're both working towards the same end of improving the patient experience, but they define it differently given their different backgrounds. So in IT, their goal is to improve the patient experience, but they talk about engagement, they talk about enrollment, they talk about net promoter scores, and that's not in sort of the history of many other people who've been working in healthcare that look at the value-based payment systems and sort of have a metric around that. So those metrics took 30 years to develop, the Prescanis, the CMS, but there's a disconnect between the two, so we're trying to bring both sides together to do that. There'll also be an interactive session on learning design thinking to make the point that how do we bring these together, and actually to bring patients into this conference to have them comment on these developments.
Francis, we'll have you wrap right there.
All right, thank you very much.
So if we can have Lisa and Elton weigh in on this one.
I thought it was, it sounds interesting what you guys are doing. There was a sentence you said, I want to say maybe a third to half the way through about we're having a conference where we're going to have people come who, have shown, and I'm sorry, I'm like not going to repeat this accurately, but who've shown how these technologies can improve patient experiences and how they help patients, something along those lines. And that to me was the what of what's happening there. And I would put that sentence up at the top because I know just personally on a busy day, I might not make it that far into the pitch to see that sentence.
Yeah, I would definitely agree with that. It was useful context, but a little too long-winded, and the context it's appreciated, but it would be more appreciated if it came like after all the data and like the why, and even like providing some concrete examples of what some of these things that are going to be discussed at the conference are going to be. That would be super helpful. On the surface, it sounds like something that I would be interested in writing about, that I think we could feature in like a shorter part of a story, but I would definitely want more like hard facts about some of the specifics of what's going to happen at the conference. Something I might reach out for, but it would be appreciated, and probably I might not even need to reach out if all that information was just kind of there in the pitch.
That's so helpful. So part of this is this phrase that gets thrown around a lot, improving the patient experience. And part of the core that I think might be different is improving the patient experience as the patient defines it. Because everyone says, well, we're improving the patient experience. But this is to say, well, how do you really know you're doing that? Why did the patient say?
Yeah,
So
absolutely.
that would go up. That would go more up front on this.
I would say so.
And name drop the people like the Sanford's Health and the Harvards that are presenting at the conference and stuff like that.
Mm-hmm. Okay. And any kind of like numerical data you have as to how these things like might be affecting the patient experience, that would be really helpful too.
So you always emphasize the positive, so I get that. So we're trying to do that too, but we're going to have a presentation which is about a disaster overseas in this field that didn't go well, because I thought it would be really helpful to the audience to hear what it sounds like when it doesn't go well and you haven't listened to your patients.
It's a negative scenario you're working to make it a positive thing, right, basically, which I think we would cover. I would have to talk to my editor specifically about it, but if I had to guess, I'd say that would be fine.
It's so curious, patient satisfaction generally isn't covered in media. Very persistent. Thank you. And I'd like to thank the Tribune for covering a front page story on that. Thank you very much.
Right. No, we want to make this as realistic as possible. And as you can see, journalists, their time is precious. And so, as Lisa mentions there, it is getting that critical information right up to the top. So last but not least, we will invite Adam from CareBand to come up.
I'm going to stand and kind of talk to you guys as well. Please raise your hand if your life has ever been affected by somebody living with dementia. Mine has too. My great Aunt Belle had dementia. One night she wandered outside of her home. It was about midnight when we noticed that she was gone. We searched for hours looking for her. We even called the police to help us look for her. After 2 hours, she was still nowhere to be found. Thankfully, after looking a little bit farther, we found her sitting on a park bench in the middle of the morning, just a mile away from our house. Thankfully, we found her and she was safe. Our case, though, is not like others. A lot of people go through this, and typically they result in injury or potentially death as well for the individual. My name is Adam Sobel, and I'm the founder and CEO of CareBand. And at CareBand, we're on a mission to reduce deaths and injuries due to dementia-related wandering. CareBand's a behavior analytics and wearable technology platform for seniors living with dementia to keep them safe and to provide peace of mind for their caregivers. We've built a wearable device that provides real-time indoor and outdoor location tracking without the use of Wi-Fi or cellular technology. We also have analytics that look at early changes in condition, things like urinary tract infections, pneumonia, and agitation, depression, to keep them out of the hospital. We're currently doing pilot testing and launching later this year. I would love for you to join me in publicizing this and getting the word out because so many people can benefit. Thank you.
You want to start?
Sure. It's a solid pitch, but if I'm being honest, it seemed more like an investor pitch than one that, at least speaking for myself, would be geared towards like the media. I am a big fan of the idea of the company. It's one that I would really be interested in writing a feature story about, but if you basically translated that exact pitch into an email and sent that to me, it would be like really heavy on like the storytelling aspect versus getting down to like the nitty-gritty facts of like what this does, who it's for, the purpose it's going to serve, which is what I would really love to see like right out of the gate. As quickly as you can get to that, that's exactly what I want to see, and then I'll do a little bit more digging, check out the rest of the story, obviously, and then also like look into your company website, things of that nature. Do my own investigation, and then I might reach out after that. But it would really largely be based on like providing as much like in-depth, objective, fact-based information as you possibly can out of the gate.
Sure.
I'll start by saying I think this is really cool. Also, I have a family story that's very similar, and I think that from that perspective, like you've got me. But echoing what Alton said, I would say, great presentation, but when you look at it as a pitch, the second half of it, when you got into the who, what, when, where, why, that's the piece that I would want up front. And then when we connect inevitably, like I would love to hear your story. I think I almost always try and ask like a founder of a company like this, like what's your personal connection to this? Because like most of the time there is one. I'll assume that's the case. But in terms of like the actual technology, like it also lends itself to like a feature story, like a more in-depth story about like, you know, what kinds of technologies are helping people living with dementia or, you know, helping caregivers. So there is something there, but I do think like in terms of pitching the media, like Alton said, like start with the second half. I'll say, this is like my journalism language, I never get to use this anymore, but use the inverted pyramid, right guys? Like, so, you know, think about like what's the most important, you want to catch the reader early and then, I don't know, sorry. I just wanted something from journalism school to still be relevant, so.
Thank you so much. I appreciate it.
I just want to say a round of applause for all the people who pitched. I hope, did you all gain some good insights out of that? Did that kind of show you how journalists respond real time? Good, because that really is the point of this. I want to, we have time for maybe one question, and there's kind of an interesting question that's been asked, and I'm not going to ask it exactly the way it's been asked. I'm going to take some liberty. If there's a product that that a company wants you to write about, does it help? Does it make a difference if they make it available to you to test out for yourselves? How do you respond to that kind of an approach?
Not for me.
Not really. It would be cool to try it out if we can. Then I mean, why not? But it's not a requirement.
Okay, Lisa.
I would say it's better if you have like a video, or even if we meet in person and you can show me how it works, as opposed to like giving me one, because then it starts to kind of cross some ethical boundaries. And that's happened to me a few times where people are like, I'm just going to give you this product for free and you can use it on yourself to see how great it is. And like, it's a nice thought, but to me it gets a little murky ethically, so I just say no thanks.
Yeah, I would say exactly what Lisa said. If you have a video that shows how it works, that's always super helpful, but in terms of trying it myself, not needed.
So does that answer that question for those of you who are, I'm not sure who's in the room for that one. And I think, you know, we've got 5 minutes left. Thank you all for hanging around and really making the most of this. Since we do have a few minutes, how about if we do go through that list of words the blacklist of words to avoid?
So to be clear, you can use these words. We probably won't use these words. But a lot of the time, I think this conversation started because of something that we had actually covered earlier, but just a lot of times when companies are describing themselves, they'll use their marketing language, which is fine, but it doesn't help us so much. Like a lot of the times we're trying to boil what you guys do down into like 3 words, a couple words. And so we don't need to know about the synergies. We don't need to know about what was the word that you used?
Disruptive.
How disruptive you are. Yeah, so that was sort of how the conversation got started. Am I missing big ones? I don't know.
What were the other ones? Health systems. There was that conversation about health systems as well.
This one's, I don't think this one's across the board, yeah, but that's one of those words that like shouldn't be as new as it is, but it still seems new, and so there's this hospital chains, health systems debate that goes on. So you might see us use different language like in each of our publications.
But I think things like saying you are in like transforming the industry or like are the most innovative, like that's unless you can more or less prove that you're doing that with like facts and things of that nature, we can't really use that type of language in our writing.
And here's how I would translate that from our in-between position. Not marketing. You are not marketing them. They are writing stories for audiences. News coverage. Remember that. Is that a good translation?
Yeah.
And I think that really, that wraps up our time. Again, thank you all. And a huge round of applause for all of our journalists. Thank you all. Have a great rest of your day.